The listening part of the occupational English test has 3 parts, and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a physician talking to a new patient, called Mrs. Delilah. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. What's your problem?
Well, I have persistent mild weakness in the left leg and occasional off and on numbness in the left hand. I have shortness of breath often.
Do you feel any weakness in your arm?
No, doctor, but I am ambulating with a cane.
Was there any history of falling down?
No, doctor. I had repeat carotid Dopplers and further imaging studies which shows no further increased stenosis in my left internal carotid artery.
Okay. What is your age?
51, doctor.
You had any illness and treatments?
Yes, I had cerebrovascular accident but got treated.
What medications are you taking?
Plavix, aspirin, levothyroxine, lisinopril, hydrochlorothiazide, Lasix, insulin, and simvastatin.
Any allergies due to medications?
No, doctor.
Is there any history of illness of your family members?
No, doctor.
Well, your blood pressure is 170/66, heart rate 66, respiratory rate 16, your weight is 254 pounds, and your temperature is 98. Normal cephalic and atraumatic, no dry mouth, no palpable cervical lymph nodes. Your conjunctiva and sclera were clear. Your cranial nerves show mild decrease in the left nasolabial fold. There is a mild increased tone in the left upper extremity. Deltoid shows 5/5. The rest shows full strength. Hip flexion is 5/5 on the left. The rest shows full strength. Reflexes were hypoactive and symmetrical. Your gait is mildly abnormal. No ataxia noted. Wide-based, ambulated with a cane. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral pedicle, with a mild left hemiparenthesis. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral peduncle, with a mild left hemiparesis, has been clinically stable with mild improvement. For now, continue using antiplatelet therapy and statin therapy to reduce the risk of future strokes. Continue to follow with endocrinology for diabetes and thyroid problems. You must strictly control your blood sugar level, optimizing cholesterol and blood pressure control, regular exercise, and healthy diet. I am planning for surgical intervention for the internal carotid artery.
Extract 2, questions 13 to 24. You hear a physician talking to a patient. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor.
Hello, Jamila. Can you brief me about your health issue?
Yes, doctor. Actually, I approached a physician about my abdominal pain 8 months back. On my chest x-ray, I had a possible infiltrate, and he thought that I might have pneumonia, and I was treated with some antibiotics and prednisone. However, the symptoms improved for a short period only, and it didn't cure my disease completely. Besides, my pain had worsened by the end of the month, and I was admitted to an emergency ward. This time my chest x-ray was compatible with pleurisy, and I was treated with Percocet. However, I was given another prescription for Ultram since I had nausea and was vomiting with Percocet. Eventually, I was referred to another doctor and was diagnosed with splenomegaly. A repeat ultrasound showed an enlarged spleen of 19 centimeters. My positron emission tomography scanning showed diffuse hypermetabolic lymph nodes of 1 to 2 centimeters diameter and an enlarged hypometabolic spleen. Finally, I had my lymph node biopsy on the right side of my neck last month, and mantle cell lymphoma was detected. 2 weeks ago, I had a bone marrow biopsy that showed involvement of bone marrow with lymphoma and also circulating lymphoma cells on peripheral smear.
And your age?
45, doctor.
Okay. What medications are you taking?
Estradiol, prometrium, 200 milligrams, Ultram whenever I get pain, baby aspirin, Lunestra for sleeping, and iron supplements.
Are you allergic to any medicine?
No, doctor.
Tell me about your previous medical history.
Yes, doctor. I got my tubal ligation in 2001, and a cyst from the left side of my neck was surgically removed in 2005. I had tonsillectomy, and I get occasional migraines.
Do you smoke or drink?
No, doctor.
May I know your job profile?
Well, I'm working as a project manager.
Tell me, is there any family history of diseases?
My father had emphysema and colon cancer when he was 68, and my mother has hypertension and arrhythmia.
Well, your heat diagnosis shows the oropharynx is benign. There is shoddy adenopathy in your neck, though, and your abdomen is soft and non-tender, and shows the palpable spleen approximately 10 centimeters below the right costal margin. Your mantle cell lymphoma is confirmed, and I would advise that you should go for chemotherapy with hyperfractionated cyclophosphamide, dexamethasone, doxorubicin, and vincristine. Discontinue aspirin for now and continue estradiol and prometrium. Take Ativan as and when you feel anxiety. You'll be given allopurinol from today and hydration further,
so that you can avoid tumor lysis syndrome.
I will plan to add Rituzan a little later on in your course since you have circulating lymphoma cells, and I'm planning to get you evaluated for bone marrow transplant in first remission.
You hear an ED nurse talking to the relative of a patient who has been recently admitted. Did you want to talk to me, Miss Tanaka?
Oh, yes, you see, I just wanted to let you know that my father, well, as you know, he's recently been diagnosed with dementia. Most of the time it's not an issue and his spats never last long. It's just that I wanted to prepare you. Sometimes he's really not himself.
Okay, Miss Tanaka. I think I understand. Can your father become aggressive?
Yes. I mean, I think it's just that he gets frustrated sometimes. He can't remember things, and I think it's scary for him. He was never ever like this before his dementia, and those periods, well, they really don't reflect his true character.
Of course. Thanks for letting me know. You hear an obstetrician describe a caesarean section to a pregnant patient.
Labour can progress differently for different people. In some circumstances, if labour is longer than expected, and if we detect that the baby is distressed, then we may have to consider an emergency caesarean section. It's a procedure that we perform in theatre, and it is carried out under spinal or epidural anaesthetic, so that you don't feel anything, but you will be awake. A screen is placed across your body, so you don't have to see what's being done. We make an incision in your tummy and womb, just under your bikini line, to remove your baby, and then stitch up the wound. It takes around 40 minutes, and your birth partner can be there at all times. Does that make sense?
You hear a GP and his practice nurse discussing their yearly schedule.
In September, we'll have a lot of new patients, as the first-year university students will all register during freshers.
Yes, we were really run off our feet last year, weren't we?
Yep, it was a madhouse.
Do you think we should hire agency staff to help out for the first couple of weeks this time around?
Well, I think part of the problem was that last year Dr. Igwe and Nurse Fletcher were both away. Dr. Igwe went to Costa Rica and Nurse Fletcher had the flu.
Oh, right, I remember. Well, we can't do much to prevent staff illness.
No, but we can ask people to avoid booking time off in those first 3 weeks.
Okay, I'll send an email out today.
You hear a nurse prepare a patient for a flu shot.
Good morning, Mr. Henderson.
Hi.
Dr. Ray has recommended that you get a flu immunization shot before you're discharged. I've got the injection ready to give you. Are you allergic to anything?
I'm only allergic to latex and penicillin. I don't know if I want the flu shot. The last time I got the shot, I got sick.
I'm sorry that happened to you. What kind of symptoms did you have after that last flu shot?
I got a runny nose and a headache, and my arm felt like someone punched me.
Sometimes the flu shot can cause reactions like a sore injection site and headache. Other common symptoms include being tired, muscle and joint aches, shivering and fever. All of these symptoms can be seen with the flu, but the shot can't give you the flu.
You hear a doctor talk to a patient about her injury.
Good morning, Mrs. Bowder. I'll be your doctor taking care of your cut there. But what exactly happened?
Oh, it's embarrassing, really. You see, I was just trying to chop some tomatoes for dinner, and the knife accidentally slipped. Oh, I'm so clumsy. I hope it doesn't hurt too much to stitch back up.
Well, we're going to numb the area now with a shot of lidocaine. You'll feel a poke of the needle and a slight burn, but afterwards the area should be numb and you'll feel nothing during the procedure.
Oh, good.
We should be finished in about 10 minutes.
Good. How many stitches will I need? And how long will they have to stay in? I'm really conscious about my hands, so I hope I don't have a scar.
I will only know for sure once I finish suturing, but by my estimation, You might require at least 4 to 5 sutures.
Oh.
They'll have to stay in for 5 to 10 days, and you'll need to come back in to get them removed. I'll do my best to try and line up the edges to create as little scarring as possible, but I can't guarantee there will be nothing there.
You hear a trainee nurse asking a senior colleague about the treatment for a patient with chronic obstructive pulmonary disease, or COPD.
I haven't treated anyone with COPD before. What would we need to do differently?
One of the most important things would be to make sure to prescribe oxygen at levels between 88 to 92%.
Okay, so why would that be necessary? If he's having trouble breathing, shouldn't we prescribe higher oxygen levels? Most patients receive oxygen at levels between 94 and 98%.
Well, in healthy individuals, a rise in carbon dioxide would result in an increased drive to breathe in order to eliminate the excess gas.
Right.
However, in some patients with COPD, this response is blunted, and their main mechanism for respiratory drive is controlled by the level of oxygen in the body instead. If the level of oxygen given to a COPD patient is increased too much, it can actually reduce the stimulus to breathe and cause hypoventilation, resulting in an increase in CO2.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear the doctor briefing his staff about guidelines for the early detection of cancer. You have 90 seconds to read questions 31 to 36. Guidelines for the early detection of cancer. I am going to explain to you the guidelines for screening different types of cancers. These screening tests are suggested to detect cancer before the patient develops any symptoms. Colon and rectal cancer and polyps. Starting regular screening at the age of 45 is suggested for people at average risk of colorectal cancer. The screening can be performed either with a sensitive test that examines for cancer signs in the stool of the person or with an exam to look at the colon and rectum. This can be done either with a sensitive test that looks for signs of cancer in a person's stool or with an exam that looks at the colon and rectum. If the person is maintaining a good health, he should continue with regular screening through to the age of 75. For people aged 76 to 85, they should confirm with the physician whether continuing with the screening is right or not. People above 85 should no longer get colorectal cancer screenings. If the person wishes to be screened with a test other than a colonoscopy, any abnormal result should be followed up with a colonoscopy. Cervical cancer. Cervical cancer screening should begin at age 21. However, women below 21 years should not be screened. Women between 21 to 29 should have a pap screening done once in every 3 years. However, HPV screening should not be performed for this age group unless it is required after an abnormal pap test result. Women between 30 to 65 should have a pap test in addition to HPV test termed as co-testing done every 5 years. This is the most suggested approach. However, having a pap test alone is also okay for this age group. Women above 65 who have had regular cervical cancer screening for the past 10 years with normal results should not be tested for cervical cancer. Once screening is discontinued, it should not be started again. Women with a history of severe cervical pre-cancer should continue screening for at least 20 years after that diagnosis, even if testing goes past age 65. The women whose uterus and cervix have been removed, total hysterectomy, for reasons not related to cervical cancer and without any cervical cancer history or severe precancer should not be screened. Women vaccinated against HPV should still follow the screening recommendations for their age groups. Women with a history of HIV infection, organ transplant, DES exposure, etc. may require a different screening schedule for cervical cancer. Breast cancer. Women from 40 to 44 should have the choice to start annual breast cancer screening with mammograms. Women from 45 to 54 should get yearly mammograms. Women above 55 may get mammograms once in every 2 years. Screening should continue as long as a woman is in good health and is expected to live more than 10 years. Women should be well informed with the known benefits, potential harms, and limitations linked to breast cancer screening. Certain women with a genetic tendency, family history, or certain other factors should get screened with MRIs along with mammograms. Endometrial cancer. I would recommend that during menopause, every woman should be informed about the risks and symptoms of endometrial cancer. Certain women with a disease history may need to opt for a yearly endometrial biopsy. Lung cancer. I would recommend yearly lung cancer screening with a low-dose CT scan for certain people prone to lung cancer who meet the following criteria. Aged between 55 to 74 years and maintaining good health. And stopped smoking in the past 15 years. And having a minimum of 30 packs per year smoking history. Prostate cancer. I would recommend that men make an informed decision after consulting with a physician whether to be screened for prostate cancer. Research has not yet proven that the benefits of screening outweigh the harms of testing and treatment. Therefore, I believe that men should not be screened without understanding about the risk factors and benefits of screening and treatment. Starting from the age of 50, men should consult a physician about the risk factors and benefits of screening so that they can decide if screening is right for them or not. If they are African American or have a father or brother who had prostate cancer before the age of 65, one should consult a physician right from the age of 45. If one decides to be screened, he should get a prostate-specific antigen blood test with or without a rectal exam. How often he will be tested will depend on his prostate-specific antigen level.
Now look at extract 2, questions from 37 to 42. You hear a doctor briefing his juniors about blood transfusion. You have 90 seconds to read questions from 37 to 42. Extracting blood or blood components products from one individual and inserting them into the circulatory system of another individual is known as blood transfusion. Therefore, the blood transfusion can also be considered a form of organ transplant. Generally, it is performed as a treatment for different medical conditions, such as massive blood loss due to surgery, trauma, shock, and other conditions in which the body tissues are not oxygenated adequately, where carbon dioxide or other toxic materials are not effectively removed, and where the red cell producing mechanism fails. Great care should be exercised during a blood transfusion to make sure that the recipient's immune system is compatible with the transfused blood, and also that the donor's immune system is compatible with the recipient's immune system. Moreover, blood type classifications A, B, AB, and O, and the rhesus factor classification, positive or negative, should be verified. Nowadays, a number of tissue type factors are also considered to determine histocompatibility. These tissue type factors become increasingly crucial in patients who receive many blood transfusions, as their bodies have to develop increasing resistance to the transfused blood. Depending on the needs of the community, at the time only parts of the blood are taken for transfusion. Blood is composed of red blood cells, platelets, and plasma. The platelets and plasma can be donated separately in a process called apheresis. In this process, blood is separated into components after being extracted from the donor. For instance, albumin protein is transfused for treating burns, and platelets used for treating hemophilia, cryoprecipitate, and immunoglobulin antibodies are transfused for treating immunological disorders. There will not be transfusion-related risk factors for the blood donor while transfusing the whole blood, besides the minute chance of infection or injury to the site. However, this is a certain risk to the donor when he donates plasma and has red blood cells reinfused. However, this risk is preventable by following appropriate sterilization procedures. Significantly, it has caused severe public health hazards in China where they were often unregulated. The plasma collection centers of the U.S. are the best-known examples of safe apheresis donation, which is maintained by pharmaceutical companies, involving paid donors up to twice a week. Interestingly, veterinarians occasionally perform blood transfusions to animals. Different species require different levels of testing to ensure a compatible match. Cattle have 11 blood types. Cats have 3 blood types. Dogs have 12 types of blood. Pigs have 16 types, and horses have 34 types of blood. The experimental and very rare practice of interspecies blood transfusions is known as a form of xenograft. That is the end of Part C. You now have 2 minutes to check your answers.